evening from wherever you're watching us from on the face of the world. You're welcome to yet another edition of your educative, informative, and entertaining show, Touch a Cell Show with Toyin and the gang. My name is Yomi Oyelami, and today we'll be discussing something that is very critical to sickle cell. In fact, one of the major complications associated with sickle cell, and that is acute chest syndrome. I have with me this evening one of our most competent and committed volunteer doctors to one of our projects, the Extra Care Free Medical Clinic, by name Dr. Tolulope Idowu. So Dr. Tolulope Idowu will be making us understand the nitty-gritty of acute chest syndrome. You're welcome.
Thank you very much.
You're welcome, Dr. Tolulope.
Thank you for having me.
It's so good to have you this evening. So let's go on this break, and as soon as I come in, we'll talk about acute chest syndrome.
Welcome. This na Baba Shukura radio drama.
They say a child born with sickle cell can live beyond the age of 21. They say sickle cell is a death sentence. They say they can't hold a job or run a successful business, that they can't live a healthy, productive life. They say. But is this true? Join Toyin and the gang on the Touch a Cell Show.
And we're back. Acute chest syndrome. When people hear the word chest, their mind goes to catarrh and all that. Acute chest syndrome, is it any of all these? Cough, chest, cough, catarrh? Is it related to any of all these?
Well, acute chest syndrome is one of the possible complications of this. It's common amongst people with sickle cell disease. Okay, I would describe it as elder brother, the common bone pain crisis, which is the vaso-occlusive crisis that is common amongst patients with sickle cell disease. As a matter of fact, majority of its acute chest syndrome has at one time been down with vaso-occlusive disease. It is primarily diagnosed in the hospital because it involves finding area of opacity test on the X-ray. What will prompt you to, as a layperson, to be suspicious of having acute chest syndrome is when you have the pneumonia symptoms. You have your cough, there's catarrh, pain, difficulty breathing, and as someone with sickle cell, these are symptoms you don't want to for granted. You want to see your doctor as soon as possible, because there's actually narrative between pneumonia and acute chest.
All right, thank you very much, Dr. That's opening salvo. So you are saying that acute chest syndrome is restricted to people living with sickle cell alone.
Sorry, didn't get that.
Acute chest syndrome,
yes,
is restricted to people living with sickle cell alone.
Yes, I'll put it that way. It's common with the common complication with people with sickle cell and other hematological disease like thalassemia, that disease in that line.
Oh, okay. So my first one is, does it happen only in children? Does it happen only in children living with sickle cell?
Across into adults. It's found both in children and sickle cell disease and thalassemia. But we're focusing on sickle cell because we're talking about.
Okay. So what are those signs? What are those signs? What are those symptoms that one will see, we now start thinking of acute chest syndrome. Or let me quickly carry this child to the hospital.
Well, like I tell my sickle cell with patient, there is no disease that is minor. There is no sickness that is minor. There is no sickness mild, so to speak, quote and unquote. With when you have a child or you yourself, you're suffering, you're having chest pain, you're finding it difficult to breathe, there is a fever, that's the sign you need to see your doctor as soon as possible for further investigation and in order to avert the complications such as acute chest syndrome. Like I not really tell you that, hey, my name is acute chest syndrome, I'm here. Okay, but it's just note of these things and consult the doctor promptly as prompt diagnosis, treatment, recovery.
Okay. So, but people will say now we are in the rainy season.
Okay.
And the weather is usually cold and all that. Even people don't have sickle cell and all that. Does it mean that anything like that comes with people living with they start thinking about acute chest syndrome?
You said that.
Okay, so what I'm saying is that we are in the rainy season.
Okay.
That is characterized by cold. And even people who don't have they can have catarrh, they can cough. So I am saying that somebody who now has sickle cell,
Okay.
and is now coughing, does it mean that person should start worrying about that maybe acute chest syndrome?
No, not at all. I said it's a condition that is it is more amongst people with usually that like sickle cell disease and beta anemia. Okay. And the reason it is common amongst them is because it's part of the possible complications comes with these conditions. Okay, it can be precipitated or can be kicked by common cold, respiratory infect the right. If you don't have sickle cell disease, you don't have other hematological disorder like beta thalassemia, you do not need to search about acute chest syndrome. However, you may be at risk of pneumonia. All right, it's sickle cell disease. Acute syndrome is just like rate of pneumonia. You understand? So if you can't take chances if you are cell disease when you have tract infection persisting or worsening and you are finding difficult to okay, just be chest syndrome in the corner. All right. Otherwise, if you don't have sickle cell, you don't have beta thalassemia, you don't have any chronic hematological that can predispose you to such complication, just see your doctor for regular respiratory tract infection treatment.
All right, thank you very much.
You're welcome.
Before we take this Dr. Idowu, just for people who don't
Sorry, I didn't get that.
For people who don't live with sickle cell,
Okay.
and are watching us right now,
Okay.
pneumonia, you mentioned it.
Yes.
What are those signs that they can see that they may feel like this can be pneumonia?
Okay. Have when there is cough, it could be productive, it may not be productive, but if you have cough, there's fever, body is very hot, person is sick, person is having chest pain, finding it difficult to breathe. There may just be pneumonia showing itself. Okay.
Thank you.
You're
Let's
welcome.
go have our sickle cell community news.
Welcome to the Sickle Cell Community News. My name is Sandra Onzilike. On the news today, comprehensive sickle cell clinic open in California. Father of 2 sickle cell warriors call for proper awareness and management. The news in full. A comprehensive sickle cell clinic opened in California. A comprehensive sickle cell clinic has been established in Southern California to improve access to adequate health care for sickle cell warriors in the area. Funded by a $500,000 state grant, the community clinic is located in the Loma Linda University Medical Center. Father of 2 sickle cell warriors call for proper awareness and management. The father of 2 sickle cell warriors and secretary of National Alliance of Sickle Cell Organization, NASCO, Gautam Dongre, has affirmed that there is a need for better understanding of sickle cell in India. In the country noted to be number 2 in the world after Nigeria, sickle cell remains a public health challenge. Mr. Dongre called for proper equipping of health facilities and training of the healthcare workforce so that detection, screening, and treatment will be made easy. And this concludes the Sickle Cell Community News for today. Kindly join us next week for a fresh package. Thank you.
And we are back. Thank you very much, Dr. Tolulope Idowu, for staying with us and for enlightening us. So now let's quickly go to treatment for acute chest syndrome. What are those things that we will do to treat acute chest syndrome? If anyone falls into that issue.
So, acute chest syndrome, most important the sickle cell patient who notice that you are coughing and cough is not resolving, getting regular antibiotics. You notice that as a sickle cell patient, you have to find yourself with cough. Your body is hot, high grade fever, difficulty breathing, chest pain. The important thing to do is to consult a doctor. Okay, there is acute chest syndrome is not diagnosis that can be you individual. Neither is it a condition that can be in the house. Okay. You need to see your doctor who will do chest X-ray and pick up capacity and then treat needed.
So acute chest syndrome
Sorry?
that can be treated in the house.
It's not a condition that can be treated at home, yes. So one of the things to do, your doctor will want to transfuse you depending on your blood level, because the complication like vaso-occlusive crisis. Okay. Out of the treatment include transfusion, maybe hydroxyurea, so and amongst other forms of treatment. These are the things. This form of treatment require professional expertise, which is what your doctor will do for you.
Thank you very much for that. Thank you very much. So, you mentioned a particular antihistamine drug. You mentioned a particular drug.
Yes,
hydroxyurea. Is this something that anybody should just enter the pharmacy shop and just get? What are the things that
hydroxyurea is a drug of course that should be prescribed by your doctor, preferably a hematologist. Okay. It is a drug that goes to a pharmacy store or without the proper prescription, because there are things that before giving and also while giving hydroxyurea that's beyond the purview of a man to handle. Should consult your doctor who would give hydroxyurea if need be.
All right, thank you very much.
You're welcome.
Doctor, one more thing I'd like to ask is acute chest syndrome. Is it preventable?
Yeah, to a good extent, it is. It is very, very preventable. In adults, it has been found that smoking or passive, both smoking, active and passive smoking. Passive smoking, I mean you staying in the environment of people that smoke, has been causing acute chest. So that means avoid smoking or in environments where they smoke, you reduce your chance of developing acute chest syndrome. It has been that two version and also bacteria like those viral and bacterial infection that causes pneumonia implicated in causing acute chest syndrome. So basically, what you want is to eat well, practice hygiene, and get it. Okay. Dress appropriate. All right. Now there's an erroneous belief that expose yourself to cold will enter your chest and then you have pneumonia. No, what cold does is it gives those organisms enabling environment to your body, especially in the respiratory tract. So it's the thriving to those organisms in the respiratory that brings about pneumonia, cold that is entering your chest, pneumonia. All right. So if you protect yourself properly by dressing appropriate during this weather and making sure you eat well to fortify your immunity, you are less likely to come down with acute chest syndrome.
Fantastic talk there. Fantastic talk. On a final note, what's your advice, your general advice for sickle warriors in this weather?
Well, I must say this is a trying weather for warriors because first the cold precipitate vaso-occlusive crisis amongst other forms of crisis. So I'd like I said earlier, I advise every warrior to dress appropriate for weather, eat healthy, rest, and stress as much as possible. Medication, drink a lot of water, take a
all right, thank you very much for your time. I actually appreciate you. Thank you very much for the show today. It's a great privilege. Thank you so much.
Yeah, thank you very much.
The said child born with sickle cell can live beyond the age of 21. They say sickle cell is a death sentence. They say they can't hold a job or run a successful business, that they can't live a healthy, productive life. They say. But is this true? Join Toyin and the gang on the Touch a Cell show.
That's the episode 12 of Touch a Cell with Toyin and the gang. We have one more episode to go this season. And after this episode, we'll be coming back for season 5. I'm sure that season 4 has been very helpful for you. In fact, if you missed any of it, you should go on our YouTube channel. YouTube channel is Sammy Update TV. Sammy Update space TV. And there you are able to watch all the previous episodes of Touch a Cell with Toyin and the gang that we have had in this season. And then you are also going to be having some powerful and enlightening content on that same YouTube channel that has been placed there just for you. It's been a pleasure hosting this show today. Thank you very much for joining us. And like we say, this show is proudly brought to you by Sickle Cell Advocacy and Management Initiative. Till next week when I see you again, enjoy the rest of your weekend. Bye.